This talk is about the principles of learning science that I use to design medical education talks. There are 5 major principles I rely on, which you can remember with the mnemonic BLAMO: bite-sized, learner, aids, motivation, and organizers. I'll discuss the science behind each of these principles, how I apply these principles in my talks, and provide examples where relevant. The first principle is bite-sized, which refers to keeping education units succinct and brief. Unfortunately, modern learners' attention spans are very short. By some estimates, attention declines after 10 to 15 minutes into a lecture, and for videos or online lectures, attention span may be as short as 6 minutes. Bite-sized teaching, also known as microlearning, is a newer approach to didactic education that involves brief, focused teaching in manageable learning units. This method has been increasingly studied in medical education and has been shown to be effective and to increase learner engagement. Therefore, I keep my talks to 5 minutes or less. I keep the scope of each topic brief enough to fit within these 5 minutes. If a topic requires more than 5 minutes, then I break it into multiple talks. The second principle is learner, which means that I keep the intended learner in mind when I am designing a talk, and adapt my teaching to that intended learner's level. Unfortunately, experts often fall prey to expert blind spot, meaning that due to their expertise, they may no longer be in touch with the specific learning needs of students. To avoid this, when designing a talk, I try to take on the perspective of the learner. For most of my talks, the intended learner is a medical student on their psychiatry clerkship, or a psychiatry intern. That is, learners who have a fairly extensive general medical knowledge, but may be completely new to the study of psychiatry. Therefore, I can assume they will be familiar with much of the context of medical practice and general terminology, but I will need to define certain terms or simplify certain concepts specific to psychiatry, in order to make them more accessible to the average new student of psychiatry. The third principle is aids, which refers to the use of memory aids, often called mnemonic devices. Memory aids help learners to cue learned material for easier retrieval, until more sustained practice leads to deeper encoding of concepts and eventual mastery. Memory aids can take many forms, but in my talks, I mostly use verbal and visual mnemonics. One example of a verbal mnemonic is seen in my anxiety disorder diagnosis talk, where I use the verbal mnemonic panic to help learners more easily recall the characteristics of panic disorder. One example of a visual mnemonic is seen in my mood disorder diagnosis talk, where I use the visual mnemonic of a pentagon, which has 5 points and looks like the D in depression, in order to remind learners that 5 symptoms of depression are required to diagnose a major depressive episode. Another example of a visual aid is seen in my affect and thought process talk, where I use visuals to help learners better understand the abstract concept of thought process. The fourth principle is motivation. Learners invest more time and effort into education that accomplishes their immediate goals. Furthermore, knowledge is more easily retained and more durable if it has practical importance. Asynchronous teaching methods, such as online videos, allow for learners to engage in just-in-time learning. That is, learning that occurs in close proximity to when the knowledge needs to be used. This is partly what motivated me to turn my talks into online videos. Learners can use them in a modular fashion, reviewing specific videos whenever they are motivated to learn about a particular topic, rather than being delivered in a predetermined order as in a traditional curriculum. I also try to focus on high-yield content, that is, content that is most likely to be practically useful. The fifth and final principle is organizers. Categories, hierarchies, and other organizational schema help learners to organize information. When provided to learners in advance by an expert, that is, when given an advanced organizer, this leads to greater learning gains. I therefore incorporate some kind of visual organizer into each of my talks, and focus on big picture concepts at first, before adding details. For example, in my psychiatric history talk, I use a visual organizer where different parts of the history are placed in different quadrants of a slide, which helps learners to mentally locate different parts of the history when they are performing an interview or giving a case presentation. This is also why I focus on producing overview talks, as I believe these will provide the highest yield for learners as they are first beginning their psychiatry education. I believe that if I can provide a sturdy foundation, it will be easier for learners to add to this foundation over time with more detailed knowledge and clinical experiences. That's the end of this talk. I hope this was an interesting look behind the curtain of how I create my educational videos, and perhaps inspires you to use these principles in your own teaching. Thank you.